θέλω να καλέσω στο βήμα την κυρία Καμακάρη και την κυρία Κουκουλά, πριν καλέσουμε την κυρία Zuendorf που θα μας πει για το Okustim. Η κυρία Καμακάρη και η κυρία Κουκουλά ασχολούνται με γενετική οφθαλμολογία. Στο όπως ξέρετε, έχουμε επενδύσει και έχουμε αγοράσει μηχανήματα και γίνονται in-house η απομόνωση του DNA και έχουμε βοηθήσει πάρα πολλούς προκειμένου να μπει μία διάγνωση και τώρα τελευταία, τα ξέρει καλύτερα βέβαια η κυρία Καμακάρη, έχουμε προχωρήσει και σε γενετικές θεραπείες με φάρμακα που προς το παρόν έρχονται από το εξωτερικό και που ευελπιστούμε τους επόμενους μήνες να υπάρχουν και στην Ελλάδα. Κυρία Καμακάρη, θέλω να καλέσετε και να εξηγήσετε περί τίνος θα μιλήσει η κυρία Zuendorf.
Καλησπέρα και από μένα. Ευχαριστώ πολύ, κύριε Δατσέρη. Θα καλέσω την κυρία Zuendorf, η οποία θα μας μιλήσει για την θεραπεία Okustim, που είναι βασισμένη σε ηλεκτροδιέγερση και αφορά τη θεραπεία της μελαγχρωστικής αμφιβληστροειδοπάθειας. Mrs. Zuendorf, I just announced you.
Thank you.
Okay.
Thank you very much. I'm very glad to have here the opportunity to show you our therapy for patients with retinitis pigmentosa with our system, Okustim. So, is it working? Not really. Should I? Like this? Here. Yes. Thank you. Well, just here I need just a recap. Why do we need with therapy? So, as I guess all of you know, retinitis pigmentosa is not just like one disease, but it's a group of diseases, inherited diseases, which is caused by many different mutations, and the common point is that the photoreceptors start dying in this disease. It starts usually with night blindness, but then suddenly the patient starts having also visual field problems. The visual field starts decreasing up to the point at which the patients are completely blind. It often starts at teenagers in this age with the night blindness in the typical cases, and when they're young adults in their working life, the visual field decrease starts progressing. And there's up to now very limited treatments for that. You might hear about maybe some genetic treatments that are now currently being analyzed in clinical studies, but there is no cure actually up to now for this disease. And for patients who are already blind, we have the retina implant, which is our mother company. We have this retinal chip so that we can give back the light to these patients at least at a low vision level. But we wanted also to offer the patients who still have functional vision to do something against the curse of this disease. So also a little bit of the recap. There is a very nice study performed by Massow and Finkelstein 2087. This is not the newest, but in my opinion, one of the best studies that characterized in a very comprehensive way the progression of retinitis pigmentosa. So actually what he saw is that starting from the critical age, which is the point in which the visual field starts decreasing, in typical cases, in about after 20 years, patients are practically blind. And this is exactly, this course is what we want to influence in a positive way. And you might also, I don't know how it is here in Greece, but in Germany I've heard from many doctors that because it is a rare disease, it takes years until the patients get the diagnosis for this, the RP. And once they get the good news that they know what they have, they get also the bad news that there is nothing really that they can do against that or to cure that disease. And this is exactly, again, our motivation. We want to offer these patients the possibility to do something against this very bad news, so to say. So how does it work, our therapy? It is a transcorneal electrical stimulation approach. So we actually put these electrodes, these electrodes which are between the cornea and the conjunctiva. These are very similar to the ERG electrodes that you use for diagnosis. And exactly the same with electrodes, you can read out the cell activity, but you can also apply current to the eye. And this is our approach. So we get this current here through the electrodes, and we actually know that it's reaching the retina because the patients see phosphines. You know, phosphines are light perception, but not induced by light. They can be induced by pressure on the eye, or in this case, electrical stimulation. And this current is not only, so to say, activating the visual cells, but actually many studies, basic research studies, indicate that actually the Müller cells get also activated with this current, and they start releasing neurotrophic factors, as are the brain-derived neurotrophic factor and ciliary neurotrophic factor, and also regulate pro-apoptotic and anti-apoptotic substances, are the BAX and BCL2. If you're interested, I recommend this study. It's very nice because they analyze in a very detailed way what can happen with electrical stimulation. And this is not the only study. There are really several studies, basic research studies, with a lot of RP models showing the positive effects of transcorneal electrical stimulation, and actually not only for RP, but also for optic nerve, problems. And the model usually is optic nerve crushed, and they have seen actually regeneration of the optic nerve after the crush. And there is also one study with healthy subjects showing that the transcorneal electrical stimulation might improve the blood flow to the retina. And this is our system, finally. So it's actually, it has three components. The stimulator, as you can see here, which is a very simple stimulator. It only has 3 buttons, so that we have really think about a product that the patients can use it at home, is easy to use. Then we have the electrodes that need to touch the cornea directly, the cornea and the conjunctiva. And the way to bring the electrodes to the optimal position is via this frame. This is just like a Google frame, and you can adjust it to each individual phase. The therapy as it is right now, as you work in Germany, once the patient gets the diagnosis, it goes to the ophthalmologist that knows how to use the therapy. There are not so many in Germany, 15 centers. And the first that they do is to adjust the frame to each individual phase. Then they can adjust the electrodes, which are disposable electrodes. Then the ophthalmologist determines the thresholds for the phosphine with our device. And based on that, we recommend to adjust the therapy current value to 100%, so twice as much current flow for the treatment. The treatment that we recommend is 30 minutes once a week. And the good part of it, too, is that this can be done only by the ophthalmologist having a special software for that. It can adjust individual parameters. These are in turn saved in this USB stick, and this stick is what the patient introduced in the device, so that we can actually, the patient cannot play around with any parameters. He can just start and stop the device. And also a nice feature is that this USB stick saves the whole information regarding the patient's compliance. So if he or she really did a therapy for 30 minutes, once a week, or even some patients might want to try it more often, or maybe not so often, it depends. And also if there were any problems with the stimulation. And this product, or this therapy, we have tested it in 3 clinical studies. This is just an overview. I will explain you shortly each of them to you. So the first study was our pilot study. It was only 6 weeks, only 24 patients were included. We already set the stimulation as it is right now, 30 minutes, once a week. We just started it 6 weeks. We had 3 groups, a sham group, so a placebo stimulation, no current flow at all. Then a group was stimulated with 66%, meaning below the threshold level for the phosphines. And one group was stimulated with 150% current flow of these individual phosphines, meaning above threshold. And the patients just came to the clinic 9 times in total, one first from the screening, then 6 weeks during the stimulation, and then 2 follow-ups after stimulation period. This, by the way, the study is already, you can read it in an IOVS paper from 2011. And what we saw in this study, it was really encouraging. We found in actually patients showing increases in the visual field. We were really very excited about that. And it was for us, since it was only 6 weeks, it was just a very good start. And it gave us really the energy to continue investigating this, because there were really encouraging results. And this was also a very important thing of this study is that, I mean, there were a lot of studies before this, like single cases, single trials, with patients not only with RP, but mainly also other ophthalmological diseases. And this was the first study, randomized control trial, according to GCP, with patients with retinitis pigmentosa using electrical stimulation. And also this first stimulation showed that the therapy was safe. There were no serious adverse events. Then, of course, we wanted to investigate more, and we did the next study, EST2. By the way, EST stands for Electrical Stimulation Therapy. This was also a prospective, partially blinded, randomized sham-controlled trial. And by the way, this study is now in press. You can maybe from February next year, you will find it in IOVS. In this study, where about 16 patients were recruited, 52, and the whole protocol, 1 year stimulation, weekly stimulation for 30 minutes using our device. The 3 groups, again, one was sham, one was 150% above threshold level, which already showed some positive results. And we also tried a higher dose, which is 200% above this threshold level. And besides the screening, patients came 12 times to the clinic every 4 months throughout this whole year. And these are the results. They were also very nice. We found, especially, very highly significant results in the ERG data. And as you can see here, the group that had the highest dose, they had an increase in the cell activity. That is, from the beginning on, from the visit 1, and you see it at 6 months after stimulation, it has this increase, and it remains mainly stable during that time. This is the amplitude, the percent change. And as comparison, we can see the sham group, how actually the cell activity is lower, and the 150 is somehow in between. And these were very nicely high statistical significant results. In regard to the visual field, we failed to find like this increasement on a group level as we saw in the ST1. However, we have this tendency that shows that the group with the highest stimulation level tend to have a more stable visual field progression. I mean, it doesn't change really, and just think about at the beginning at this exponential curve that I show you with the visual field. So here we have a stabilization, whereas the group with 200, it gets down in a more, you see the curve here, and the 150 group, I mean, it's not really convincing, but especially the 200, we can see really how these visual fields are more stable. And the therapy, we could demonstrate that it was safe. Most of the adverse events were just, dry eye symptoms during stimulation. So the patients needed usually to put some eye drops to alleviate this, and this also makes the stimulation easier. But once the stimulation is over, then it's okay. The patient have no further symptoms at all. So just summing up shortly about this study, we showed the significant increase in the cell activity, showing that actually we're doing something good for these cells. We're giving some support to these cells which otherwise might be just dying, and the ERG would be just lower or not that good. We show also this positive trend for visual fields, and we think we might see the significant results if we had a longer study, just to compare really the normal progression and the progression or the positive influence if we have the therapy. And this was tolerated well for this whole time. And again, we had only few adverse events, and there was no serious adverse event at all. And then we had a third study, I mean, not like a clinical study, it was more like an observational study, and our primary point was here to observe the safety. And this was not in just one site, but in 11 sites across Europe. And 105 patients were included in this observational study. All of them were treated only with 150, and the reason why is because by the time we started with this trial, the EST2 wasn't finished yet, so it was decided that we should continue with the stimulation with the current as we tried in the first study, in the pilot study, and the fellow eye served as a control. And they were stimulated for 24 weeks, and they came every 3 months to the clinic, and then after stimulation period also 2 times for follow-up examinations. And here we didn't have any strict observation of efficacy parameters like visual fields or ERGs. Just the sites, they did all the analysis on all the measurements, but each site with different, using different devices, so that's why we just focus here on the safety and not on the parameters. And the nice thing is that we confirmed indeed with this study the safety of the device. And we saw again, the most common adverse event was the dry eye, which again could be easily alleviated with these eye drops. And otherwise, there were just few other cases of device-related adverse events. And we saw again a positive influence on the visual function. Well, on the visual fields, it's not really something that we can see accurately what happened there. As I told before, all the sites had different devices, different methods to measure this. Some of them did static perimetry, some of them with kinetic perimetry. But at least we can see here there's a kind of a stabilization, and a couple of eyes indeed got better, whereas the control eye not necessarily. But really, the nice surprise of this study, because we didn't expect it to happen, is that the worst eye got stimulated, and we see actually in the visual acuity how the worst eyes got better and remained stable, whereas the control eyes, they don't show any change during this time, and these results were also significant. So summing up, this therapy has shown the potential to slow down the typical course of this retinitis pigmentosa disease. Why we think that it has this potential, we have to think on a long term, thinking about, again, this curve that I showed you at the beginning. We base that because we have this very high statistically significant results showing higher cell activity measured by ERG, which is an objective measure. We have the visual field showing this positive trend towards stabilization. We have the significant results in visual acuity. And there are, moreover, so many basic research studies showing the positive effects of transcorneal electrical stimulation, not only in RP, but also in many other ophthalmological diseases. Also very important, all the studies have shown that the therapy is safe, and the next steps are towards trying out this therapy in further ophthalmological diseases. I also would like to show you where we are in Europe right now. So we are mostly in Germany. This is in this country, because we come from Germany, is where we have the therapy, the best offered to the therapy. We have 15 sites, 50 mostly university clinics offering the therapy. We're also here present in Greece, that's very nice for us, in Austria, Switzerland, and Turkey. And we're also working pretty hard to bring our therapy to France, Italy, and UK. And I would like to show you how the normal patient care works in Germany. First of all, once the patient gets the diagnosis, we encourage doctors, which usually in their practices, they might see only 1 or 2 patients with RP in their whole lives. We encourage them to send these patients to our competence centers, which are one of the 15 in Germany. Then the experts there who know exactly how to use our device, they check whether the patient is eligible or not for the therapy. Then the patients get the chance to get 4 training sessions to see how he or she copes with this stimulation, and then the patient can decide whether he wants to do at home, which is usually the most convenient a way of doing the therapy. Then the patient gets his own device, and then he goes to the clinic every 3 to 6 months for checkups. Or the patient can also decide to go every week either to the clinic or to low vision opticians to whom we cooperate with. And it's also important when patients get this device and when patients are eligible for the therapy, they need a prescription for the doctor to get this device, and also in these checkups every 3 to 6 months, they get also prescription for the electrodes, which are disposable. So it's very important in that way that we make sure that the patient goes regularly to the checkups to the ophthalmologist. And that's it. I thank you very much for your attention. And yeah, if you have any questions, you can contact here in Greece or a distributor partner. Thank you very much.